This patient is a 35-year-old young woman who presented with complaints of heavy bleeding and pain during her cycles. The pain was getting worse and worse and worse over the past year. And then over the past 2-3 months, her cycles were even heavier and blood clots. And she felt like she was reporting it was as though her uterus was trying to push something out. She presented to her gynecologist, who did an ultrasound and found fibroids, and then she was referred to me for evaluation and treatment. During her first visit, we did a procedure called hysterosonography, which is a specialized evaluation of the uterus, where I inject a little bit of a saline inside the uterus. It opens up the cavity of the uterus, and the ultrasound can very accurately identify where these fibroids are sitting, how many of them there are, and helps us in deciding what the best option is. Her fibroid was found to be 33.5 by 3.2 centimeters, so about the size of a small lemon, and it was sitting in the cavity of the uterus. So we decided to do a hysteroscopic procedure where a camera is inserted through the vagina, dilate the cervix, and go inside the uterus, into the cavity of the uterus, and then using a special resection device, as you see in the video, to remove the fibroid. So in this video that you're looking at, the white patch, the white growth, is the fibroid tumor. The rest of the pink area is the normal cavity of the uterus. So during this procedure, fluid is injected inside the uterus. Of course, this is under anesthesia. The patient is sleeping at this point. The fluid is going inside. It's just regular saline. This is a mechanical dissection. There's no electrical current involved. There's no the chance of scarring is significantly less when this is performed this way. And basically the metal probe that you're looking at, is like a punch biopsy, and what it's doing is that it's taking pieces of that fibroid and sucking it back out, so we can send it to the laboratory and have it analyzed for any abnormal tissue, or verify that this actually was a fibroid. The procedure lasted approximately 20 minutes. It's a fairly large fibroid, so it has been there and had been growing for some time, but because it had no symptoms and they had not looked at it, they had not looked for it, they was never discovered until it started creating symptoms. The procedure was very successful. If you watch it till the end, you'll see that the entirety of the fibroid has been resected, and the endometrial cavity should restore itself to its normal position. And this lady, as I said, was trying to get pregnant and had difficulty achieving pregnancy, so this definitely should help increase her chances of a successful pregnancy as well.